Today, I want to talk about periodontal disease, which we often hear referred to as gum disease, and why it matters and how it relates to our heart health. So, what is gum disease? And you'll kind of hear me refer to gum disease and periodontal disease interchangeably. But in order to really explain what the disease is, there's some pictures here that will help with anatomy. So, the picture shows a tooth, and the tooth sort of sits within bone, we call alveolar bone. And around the tooth is also some ligaments and tissues, periodontal ligaments. And so when we have gum disease, and it really should be called bone and gum disease, the tissues around the tooth get inflamed and infected. And so you can see the normal tooth, and then on the right, the tooth with periodontitis. So bacteria and plaque really get stuck in these pockets right here where there's sort of this red inflammation on the picture. And that causes all of the tissue and the bone to get really angry and pull away from the tooth. And so in turn, you can lose the tissue and you can also start to lose bone. And the bone is really what anchors the tooth into our mouth. So that's kind of the start of gum disease. And then I added into this picture on the right a little black instrument. You can see just this little, looks like a V. And if you've ever been to the dentist and they've shouted out those numbers and you don't, it's kind of like, what are all these numbers? 332, 445. That's what we're measuring, is this little pocket here. And anything under a 4 millimeter pocket is what we're looking for as far as healthy tissue. And when the tissues start to pull away and your numbers get bigger, that's when the gum disease has progressed. And I'll just go to the next slide. So here's another picture. This time, this picture is of an X-ray. And in this picture, you can see the bone has receded quite a bit. And this premolar right next to the molar, the skinny one, it has quite a bit of bone loss. And you can imagine anything that's supposed to be anchored into bone and you get that much bone loss, your teeth start to get really loose and they can oftentimes fall out. Unlike cavities, which give us some teeth pain and really alert us to the infection, periodontitis and gum disease can really be silent and have no symptoms at times because you can't feel the bone as much as you can the nerves that run through the teeth. And this is a really powerful picture that we like to show. It's sort of just a progression of when you've lost all your teeth, what happens to the bone in your jaw. And on the left is a normal looking side profile with an individual who has all of her teeth. And then in the beginning of after they've lost their teeth, our teeth are really what keep our bone in place. And so if we lose our teeth, bone will just keep receding and receding. So on the right, she has really thin jawbone. And I wrote some notes here on the right as well, where once you get a thin bone like in the picture, it can be really hard to replace teeth. So your options become very limited. Dentures don't fit very well. There's really no option for implants, leaving you with a really poor quality of life. We need our teeth to eat. We need our teeth to talk, to sing, to do everyday living. So a lot of times we kind of think, oh, it's okay. Well, if we lose our teeth, I'll just get dentures or I'll get implants. We'll take care of it. But what's important to note here is that once you've lost enough bone, those options don't become available to you. We are experiencing periodontitis at a higher rate than US overall, so 17% compared to 10%. So this just, for me, what this shows is that we have a lot of potential to improve our periodontitis. I want to talk about how gum disease is very different from periodontal disease. Like I said in the beginning, a cavity can really, tooth pain is horrible. So you can wake up and know my tooth is hurting, there must be a cavity there, I'm going to go to the dentist. Periodontal disease we don't feel it always. You can kind of have aggravated gums, but it can happen really silently. So cavities really happen in the tooth itself, not in the bone surrounding the tooth. And this happens when bacteria and plaque weaken the tooth structure and cause decay. And you can see the start of holes in your teeth or maybe like a little black dot. These are cavities happening. Both of these can lead to tooth loss. If you lose too much of your tooth structure and you have too much decay, then you may lose that tooth. But the bacteria involved in both of these disease processes can be different. I have a little picture too to help with this. So both are caused by bacteria, but this picture, the bone is still in place, the ligaments and tissues are still in place, but you can get a little infection at the base of the tooth. And this can be treated with a root canal or with a filling. And this is very, very different than the bone loss and the tissue loss that you would get with periodontal disease. So cavities are actually not as related to heart disease as periodontal disease. So the gum disease and the bone disease is really what we're looking at as something that would affect your heart, and I'll get into that. So how do we get periodontal disease is the question. And there are some risk factors that are really shared with heart disease. Smoking really affects the different bacteria in your mouth and our natural microflora. So just all the little healthy bugs that we have in our oral cavity. And also it really impacts healing. So diabetes as well, impacts our healing time and can increase our risk for gum disease. Poor oral hygiene causes cavities and can cause gum disease. So not brushing and letting the plaque and bacteria accumulate. Flossing as well is really what helps to get the floss next to the tissues and build them up. So just like we lift weights for our muscles, the tissues, if they're getting flossed, and they can really build up stronger. And then infrequent visit to the dentist, like I said, this can help just see how you're doing, how much bone you have, and help see where you're at in your disease process. Also can help with cleanings. And periodontal disease can be genetic. If you have a risk factor in your family, did your mom or dad lose their teeth at an early age, then this is something to be watching out for yourself. Okay, so treatment for periodontal disease. The best thing we could do is go to the dentist, get those measurements where they shout out the numbers 2, 2, 3, because that really helps with baseline to monitor the disease. And then we call deep dental cleaning scaling and root planing. So if you've ever heard the dentist recommend deep cleanings, this is where we get you numb and we can really dig deep into those pockets that I was talking about in the beginning of the presentation. And this is different than just an overall dental cleaning. It's very specified to any areas that you're experiencing gum disease at. And then we keep you on what's called periodontal maintenance, which is just a fancy term for bringing you back more frequently than we would if you didn't have gum disease. And one of the biggest questions is, once you get all of this treated, can bone grow back? And the answer is no. So when we get these deep cleanings, you can get healthier tissues. The tissues can get less angry, but you'll never get the bone that you lost back. And so that's really important in thinking about keeping gum disease under control, because that's not something that the dentist can ever put back.
So Lindsey, we have a question that came up. Can you reverse gum disease though? Even if you can't reverse the bone loss, can you address that?
Yes, so gum disease can come to a place of stabilization where you don't have inflammation. It's not red, it's not angry, it's really healthy, but the bone will never grow back. So that's really the goal. If you have bone disease, gum disease already, and you get all of these deep cleanings, you keep up on it, then you can prevent any bone loss from getting worse. And also your tissues will become nice and strong, and they won't be as angry and inflamed. So you can come to a place where you're not in a disease state anymore. You're in a healthy state with your gums, but the level of bone that you've lost will never come back. This is where we really get into how it affects our heart. So looking at the tooth in the middle, these little blue and purple dots are showing the bacteria and the beginning of gum disease. The tissue and the bone has started to recede and it's really red and angry. And then all of this inflammation, which happens in our gums, goes into our bloodstream and throughout our whole body. So these bacteria and toxins and other things that happen with inflammation is disseminated everywhere. And so you can, and going to the next picture on the top is where we get proteins, where if you already are predisposed to heart disease, or you have heart disease running in your family, you've already had events for yourself, then this can actually be made worse with periodontal disease. The inflammation causes atherogenesis, again, fancy word for just the accumulation of this plaque on our teeth gets plaque in our heart. And then it can lead to different cardiac events, heart attack, stroke, and also pregnancy complications. So for you, if there's anyone out there who's also pregnant like myself, controlling gum disease, controlling our oral health is really, really important. So that's how the mouth and the body are very connected. And I didn't know this till I went into school, is that they kind of go both ways. So if you've had a history of heart attack or have a history of heart disease, this can also make you predisposed to, or you can get more chance of periodontal disease. So that's something also to keep in mind. And so, just like I mentioned, new research is showing really strong connection for heart disease and gum disease. And many of these risk factors are shared. So treatment for periodontal disease has been shown to lower all of these protein, these markers, these plaques within our heart and without other areas of our body. So getting these deep cleanings, any cleanings, going to the dentist can really help with preventing heart attacks or strokes in the future. And then keeping your teeth for a lifetime can help with eating and is just important for holistic health. I hate when I have to see patients who really need to get a lot of teeth extracted, because it can be really, really hard to replace them. And even with dentures are never going to be the same as real teeth. So patients really struggle with having lower dentures in particular, because they're never going to feel like teeth. Okay. And then what can we do? Like I've mentioned, really try to increase brushing. I think that part of this is access to care. Can we get to dentists? And then also, just the systemic trauma that we've experienced has predisposed us in many ways for a lot of different diseases. And so it kind of is looking at the body holistically. When we're not healthy, it can show up in a lot of different areas, including our teeth. And I have so many fillings in my mouth just from middle school, from elementary school. We get our first tooth when we're 6. So my parents, I remember asking them, did you brush my teeth? And they were like, we just let you, brush how you could. So I have a filling in almost all of my back teeth, the large fillings. And so I think if we just don't know we should be brushing, or again, I didn't know any of this until I went into dental school, then it can progress, at a much younger age. I now know to, if my son's crying, sometimes we have to hold him down a little bit and brush his teeth, but that's not something that my parents did for me. So I think not knowing how to brush or what foods we should be eating also makes it really difficult to have a healthy mouth when we're older. So all of these things play into it. And I went into dentistry because, and I love being part of the Strong Heart Study because my dad had his first heart attack at age 39. So I understand how scary it can be. He's already had quadruple bypass and he's not 60. So I try to talk to my parents all the time about sort of what their mouth looks like and how to brush. And so all of these things kind of play into why we're experiencing higher rates of periodontal disease. Diabetes is also really important, and that's something that we also experience higher rates of. So yeah, I've mentioned all of these things in this list, but try to eliminate smoking. And like Marcia was saying earlier, really, really helpful to take your medications and control your diabetes and high blood pressure. All of these things can help with a healthy mouth.